Welcome to the Retirement Briefing. If you've been following our Medicare series, you've already learned how Original Medicare covers hospital care through Part A and outpatient medical services through Part B. You've also seen how Medicare Advantage combines those benefits into a private health plan. But there's one major piece of Medicare that we haven't explored yet: prescription drug coverage. For many retirees, prescription medications become an increasingly important part of healthcare. Whether it's medication for high blood pressure, diabetes, heart disease, arthritis, asthma, or another chronic condition, prescription costs can quickly add up. Without the right coverage, even common medications can become a significant financial burden over time. That's where Medicare Part D comes in. Medicare Part D is the prescription drug benefit within the Medicare program. Unlike Parts A and B, which are administered directly by the federal government, Part D coverage is offered through private insurance companies that are approved and regulated by Medicare. Every Part D plan must meet federal standards, but each insurer has flexibility in how it designs its plan, including which drugs it covers, what pharmacies are in its network, and how much beneficiaries pay for specific medications. This is why no two Part D plans are exactly alike. Some plans have lower monthly premiums but higher out-of-pocket costs when you fill a prescription. Others charge a higher premium but provide better coverage for expensive medications. The best plan depends on your individual prescriptions, your preferred pharmacy, and your healthcare needs. One common misconception is that Medicare automatically includes prescription drug coverage. It doesn't. Original Medicare generally does not cover most outpatient prescription medications that you pick up from your local pharmacy. While medications administered during a hospital stay or certain treatments in a medical facility may be covered under Part A or Part B, most everyday prescriptions require separate drug coverage through Medicare Part D or through a Medicare Advantage plan that includes prescription drug benefits. If you have a Medicare Advantage plan, there's a good chance your prescription drug coverage is already built into that plan. These are often called Medicare Advantage Prescription Drug Plans, or MAPDs. However, not every Medicare Advantage plan includes drug coverage, so it's always important to review your specific plan documents carefully. If you have Original Medicare, you'll usually need to enroll separately in a standalone Part D plan if you want prescription drug coverage. Another question many people ask is whether they should enroll in Part D if they don't currently take any medications. The answer isn't always straightforward. Some retirees take very few prescriptions today and wonder if paying a monthly premium is worthwhile. However, health needs can change unexpectedly. A diagnosis, surgery, or new medical condition could require expensive medications with little warning. In addition, delaying enrollment without having other creditable prescription drug coverage may result in a permanent, late enrollment penalty that increases the cost of your Part D coverage in the future. We'll explain exactly how that penalty works later in this video because it's one of the most misunderstood parts of Medicare. Throughout this episode, we'll also explain how Part D plans decide which medications they cover, why the same prescription may cost different amounts under different plans, how the redesigned Part D benefit limits annual out-of-pocket drug spending, and what you should review each year before choosing or changing a plan. By the end of this guide, you'll understand not only how Medicare Part D works, but also how to choose coverage that fits your medications, your budget, and your long-term healthcare needs. Let's begin by looking at exactly how Medicare Part D plans are structured and how they determine what you'll pay for your prescriptions. Now that you understand what Medicare Part D is, let's look at how it actually works and why two plans that appear similar can produce very different costs for the same prescription. Unlike Original Medicare, Part D isn't a single government-run prescription plan. Instead, Medicare contracts with private insurance companies that offer approved prescription drug plans. Every plan must meet Medicare's minimum standards, but each insurer designs its own list of covered medications, pharmacy network, premiums, deductibles, and cost sharing. The first term you'll often hear is the formulary. A formulary is simply the plan's official list of covered prescription drugs. Every Part D plan maintains its own formulary, and while many common medications appear on most lists, coverage can vary from one plan to another. That's why it's important to verify that your medications are included before enrolling in a plan. Let's look at a simple example. Imagine Susan takes 3 prescription medications every month, one for high blood pressure, one for cholesterol, and one for diabetes. She compares 2 Part D plans with nearly identical monthly premiums. At first glance, they seem almost identical, but after checking each plan's formulary, she discovers that one of her diabetes medications isn't covered by Plan A, while Plan B covers all 3. Although Plan A has the lower premium, Susan could actually spend much more during the year because she'd have to pay the full cost of one prescription. That's why checking the formulary is one of the most important steps when choosing a Part D plan. Part D plans also organize medications into different drug tiers. Think of these as pricing categories. Lower tiers usually contain generic medications with the lowest copayments. Higher tiers often include preferred brand name drugs, non-preferred brands, specialty medications, or other high-cost treatments that require greater cost sharing. The exact number of tiers varies by plan, but the basic idea is the same. The higher the tier, the more you may pay. This is also why your doctor or pharmacist may occasionally recommend a generic alternative. In many cases, a generic medication provides the same active ingredient and similar medical benefit as its brand name counterpart, while costing both you and the insurance plan considerably less. Another important factor is the pharmacy you choose. Most Part D plans have a network of participating pharmacies. Within that network, some pharmacies are designated as preferred pharmacies. Filling your prescriptions at a preferred pharmacy often results in lower out-of-pocket costs than using a standard network pharmacy. For example, imagine you fill the same prescription at 2 pharmacies that both participate in your Part D plan. One is a preferred network pharmacy, while the other is a standard network pharmacy. Even though both pharmacies are covered, your copayment may be lower at the preferred location. Taking a few minutes to compare pharmacies could save money throughout the year. Many plans also offer mail-order pharmacy services. If you take maintenance medications every month, receiving a 90-day supply through mail order may be more convenient and, in some cases, less expensive than filling 1 month at a time. Part D plans also use several tools to help manage prescription drug costs while helping ensure medications are used safely and appropriately. 3 of the most common are prior authorization, step therapy, and quantity limits. Let's begin with prior authorization. This means your doctor must obtain approval from the Part D plan before certain medications will be covered. The insurance company reviews the request to determine whether the medication meets its coverage guidelines. This doesn't necessarily mean the medication will be denied. In many cases, it's simply an additional review process to confirm that the treatment is medically appropriate. Another common tool is step therapy. Under step therapy, you may first be asked to try a lower-cost medication that has been shown to treat the same condition effectively. If that medication doesn't work well for you or causes unacceptable side effects, your physician can request coverage for a different or more expensive alternative. While this process may seem inconvenient, It is intended to encourage safe, effective, and cost-conscious treatment whenever possible. Some medications are also subject to quantity limits. For example, a plan may cover only a certain number of tablets or doses during a specific period unless your physician documents a medical reason for a larger quantity. These limits are often based on recommended clinical guidelines and are designed to reduce the risk of medication overuse while helping manage overall prescription costs. Although these requirements can occasionally delay access to a medication, they are standard features of many prescription drug plans and are not unique to Medicare Part D. Another important point to remember is that your Part D plan isn't set in stone. Insurance companies review their plans every year. Premiums may change, deductibles may increase or decrease, pharmacy networks can be updated, and medications may move to different drug tiers or even be removed from a plan's formulary. That's why reviewing your coverage every year is so important. A plan that worked well this year may not be the best choice next year if your medications change or if your current plan changes its benefits or costs. During Medicare's annual open enrollment period, you have an opportunity to compare available plans and determine whether another option better fits your healthcare needs. Even if you're satisfied with your current coverage, spending a little time reviewing your options each fall could potentially save you money over the coming year. The key takeaway is that choosing a Part D plan isn't simply about selecting the lowest monthly premium. The best plan is one that covers the medications you actually take, provides access to pharmacies that are convenient for you, and keeps your overall annual prescription costs as low as possible. Now that you understand how Part D plans are structured, let's look at what you'll actually pay. In the next section, we'll explain premiums, deductibles, copayments, coinsurance, the annual out-of-pocket spending limit, and the late enrollment penalty. Some of the most important financial rules every Medicare beneficiary should understand. Let's continue with Robert, a retired Medicare beneficiary. Robert has original Medicare and has enrolled in a standalone Medicare Part D prescription drug plan. Like many retirees, he takes several prescription medications each month to help manage chronic health conditions. The first cost Robert pays is his monthly Part D premium. This is the amount he pays every month simply to keep his prescription drug coverage active. Premiums vary from one plan to another because each private insurance company sets its own pricing. A plan with a lower premium isn't always the least expensive overall. Sometimes paying a slightly higher monthly premium can result in lower prescription costs throughout the year. Next comes the annual deductible. Think of the deductible as the amount Robert may need to pay out of his own pocket before his Part D plan begins sharing the cost of covered medications. Not every Part D plan has the same deductible. Some plans have no deductible at all, while others charge the maximum deductible allowed under Medicare rules. It's important to understand that the deductible generally applies only once each calendar year. After Robert satisfies his deductible, his Part D plan begins sharing the cost of covered medications. This is where you'll usually encounter either a copayment, often called a copay, or coinsurance. Although these terms are sometimes used interchangeably, they work differently. A copay is a fixed dollar amount that you pay for a prescription. For example, Robert may pay a $20 copay each time he fills one of his generic medications, regardless of the pharmacy's actual cost for that prescription. Coinsurance works differently. Instead of paying a fixed dollar amount, Robert pays a percentage of the medication's cost. Suppose a medication costs $100 and his coinsurance is 25%. Robert would pay $25, while his Part D plan pays the remaining $75. Now imagine another medication costs $400. With the same 25% coinsurance, Robert would pay $100 out of pocket. As you can see, coinsurance can become significantly more expensive as the cost of the medication increases. This is one reason why comparing plans based only on their monthly premium can be misleading. Two plans may charge nearly identical premiums, yet one plan may rely mostly on fixed copays, while another uses percentage-based coinsurance for many medications. Depending on the prescriptions you take, that difference could have a noticeable impact on your total annual healthcare costs. Let's look at a simple comparison. Plan A charges a lower monthly premium, but requires higher coinsurance for several of Robert's medications. Plan B charges a slightly higher monthly premium, but most of Robert's prescriptions require only fixed copays. Although Plan B costs a little more each month, Robert could actually spend less over the course of the entire year because his out-of-pocket prescription costs are more predictable. That's why financial experts often recommend looking beyond the monthly premium and estimating your total annual costs before choosing a Part D plan. Your medications, your pharmacy, and the plan's cost-sharing rules all work together to determine what you'll actually spend. So far, we've looked at the routine costs you may pay throughout the year. But Medicare Part D also includes important financial protections that help limit how much beneficiaries pay for covered prescription drugs. In the next section, we'll explain the annual out-of-pocket spending limit, how it works, and why it's one of the biggest improvements to today's Medicare Part D program. So far, we've looked at the routine costs you may pay throughout the year. Now let's discuss one of the most important improvements to Medicare Part D, the annual out-of-pocket spending limit for covered prescription drugs. Let's return to Robert. Over the course of the year, Robert continues filling his prescriptions every month. As he pays deductibles, copays, and coinsurance for his covered medications, those eligible out-of-pocket expenses accumulate. Once Robert reaches the annual out-of-pocket spending limit established under Medicare Part D, his costs for covered prescription drugs change significantly. For the remainder of that plan year, Robert won't have to continue paying copays or coinsurance for covered Part D medications. This provides important financial protection for people with high prescription drug costs and makes it easier to predict their maximum annual spending. However, it's equally important to understand what does and doesn't count toward that annual limit. Generally speaking, the deductible you pay, along with eligible copays and coinsurance for covered Part D medications, count toward reaching the limit. Your monthly Part D premium, however, does not count toward your out-of-pocket maximum. In other words, you'll continue paying your monthly premium to keep your prescription drug coverage in effect, even after you've reached the annual spending limit. Another important feature available to many beneficiaries is the Medicare Prescription Payment Plan. Despite its name, this program doesn't reduce the total amount you owe for your medications, nor is it additional insurance. Instead, it helps spread your eligible out-of-pocket prescription drug costs into monthly payments over the course of the plan year. For retirees who take expensive medications early in the year, this can make monthly budgeting easier by avoiding large pharmacy bills all at once. Finally, let's discuss one of the most misunderstood parts of Medicare Part D, the late enrollment penalty. If you delay enrolling in Medicare Part D and you don't have other creditable prescription drug coverage, you may have to pay a late enrollment penalty when you eventually join a Part D plan. In many cases, that penalty remains part of your monthly premium for as long as you have Medicare prescription drug coverage. The key phrase is creditable prescription drug coverage. This simply means you already have prescription drug coverage that Medicare considers to be at least as good as the standard Part D benefit. For example, many employer or union health plans provide creditable prescription drug coverage. Veterans who receive prescription benefits through the Department of Veterans Affairs may also have creditable coverage. Likewise, beneficiaries covered by TRICARE generally have creditable prescription drug coverage. If you maintain this type of qualifying coverage, you can often delay enrolling in Part D without triggering a late enrollment penalty. However, if that coverage ends, it's important to understand your enrollment deadlines so you don't unintentionally create a penalty that could follow you for years. The good news is that most of these penalties are avoidable with a little planning. Understanding your enrollment options, reviewing your existing prescription drug coverage, and comparing plans before making a decision can help you avoid unnecessary costs while ensuring you have the protection you need. Now that you understand how Medicare Part D costs work, the annual out-of-pocket limit, and the rules surrounding late enrollment, you're ready for the next step. Learning how to compare plans and choose the Part D coverage that's the best fit for your healthcare needs and your budget. Choosing the right Medicare Part D plan isn't simply about finding the lowest monthly premium. The best plan is the one that provides the prescription drug coverage you need at the lowest overall cost while giving you access to the pharmacies you prefer. A good place to start is with your current medications. Make a complete list of every prescription drug you take, including the dosage and how often you refill it. Even if you only take a few medications today, think about whether your healthcare needs may change in the coming year. Next, confirm that each medication is included on the plan's formulary. Remember, every Part D plan maintains its own list of covered drugs. Two plans offered in the same area may cover the same medication differently or place it in different pricing tiers. That difference can affect how much you'll pay throughout the year. Your choice of pharmacy also matters. Many plans offer lower costs when you use preferred network pharmacies. If you have a pharmacy you've trusted for years, make sure it's included in the plan's network before enrolling. Otherwise, you could end up paying more than expected or need to switch pharmacies. As we've discussed, don't focus only on the monthly premium. Compare your estimated total annual costs, including premiums, deductibles, copays, and coinsurance. A plan with a slightly higher premium may actually save you money if it offers lower prescription costs for the medications you take most often. It's also important to remember that Medicare Part D plans can change from year to year. Premiums may increase or decrease. Formularies can change. Pharmacies may enter or leave a network, and medications can move from one pricing tier to another. That's why reviewing your coverage every year is one of the smartest financial decisions you can make. Fortunately, you don't have to compare plans on your own. Medicare provides an online plan finder tool that allows you to enter your zip code, your medications, and your preferred pharmacies. The tool estimates your annual prescription drug costs and helps you compare available plans side by side. For many beneficiaries, it's one of the most valuable resources available during Medicare Open Enrollment. If comparing plans feels overwhelming, remember that help is available. Your State Health Insurance Assistance Program, commonly known as SHIP, offers free, unbiased counseling to Medicare beneficiaries. A trained counselor can help you understand your options and compare plans based on your individual healthcare needs. Your pharmacist can also be an excellent resource. In some situations, a lower-cost generic medication or an alternative drug may provide similar results while reducing your annual prescription expenses. Any medication changes, however, should always be discussed with your prescribing healthcare provider before they're made. Finally, don't assume that the Part D plan you selected several years ago is still your best choice today. Your medications may have changed, your health needs may be different, and new plans may now be available in your area. Taking a little time each year to review your options could save you hundreds or even thousands of dollars over the course of your retirement. Now that we've covered how Medicare Part D works, what it costs, and how to choose the right plan, let's wrap everything together with the key points every Medicare beneficiary should remember. Throughout this guide, we've explored the key parts of Medicare Part D, from understanding what it is and how it works, to managing prescription drug costs and choosing the plan that's right for you. Let's quickly review the most important points to remember. First, Medicare Part D helps pay for covered prescription medications through private insurance plans approved by Medicare. Whether you enroll in a standalone Part D plan with Original Medicare or receive drug coverage through many Medicare Advantage plans, prescription drug coverage can play an important role in protecting your retirement budget. Second, every Part D plan is different. Premiums, deductibles, formularies, pharmacy networks, and cost sharing can vary from one plan to another. That's why it's important to compare plans based on your own medications and your expected annual costs, rather than choosing a plan based only on its monthly premium. Third, today's Medicare Part D program includes important financial protections, including an annual limit on eligible out-of-pocket spending for covered prescription drugs. Understanding how these protections work can help you better plan for healthcare expenses throughout retirement. Fourth, don't overlook enrollment deadlines. If you delay enrolling in Part D without having other creditable prescription drug coverage, you may have to pay a late enrollment penalty that could increase your monthly costs for as long as you have Medicare prescription drug coverage. Finally, remember that your healthcare needs can change over time. Reviewing your Part D coverage each year during Medicare. Open enrollment helps ensure your plan continues to meet your needs and may even save you money if better options become available. If you found this guide helpful, please consider subscribing to the Retirement Briefing. Our goal is to provide clear, practical, and unbiased information that helps you make more informed retirement decisions. If you have questions,